Okay, so I would like to begin by introducing myself. My name is Safiya Addison, and I'm the Vice President for School and Community Programs here at the Child Mind Institute. Today, we will be having a very important discussion to discuss a study that was done in 2024 with our esteemed panelists, Dr. Rhonda Boyd, Ade Cox, and our presenter, Faith Wilkins. Dr. Boyd, would you begin by introducing yourself?
Good afternoon, or maybe good morning, wherever you are located. For this study, I served as a mental health advisor for the Steve Fund and helped support this study. I'm also a psychologist at the Children's Hospital of Philadelphia and associate professor at the University of Pennsylvania Perelman School of Medicine. I do research mostly on youth, also perinatal depression, and done multiple research studies working with Black families.
Thank you, Dr. Boyd. Ade?
Good morning, good afternoon, um, depending on what time zone you are in. Good morning on my side from the West Coast, but I'm a Brooklyn resident. My name is Ade Cox. I am the co-founder and head of education impact at the Ella Baker Institute. To just give you a little bit of color of what we do at EBI, we are a nonprofit organization centered around leadership development and community well-being. And this shows up in three different buckets of work. We do org development work, where we support different social impact organizations, universities, educational institutions, or on creating MEL measurement evaluation tools to comprehensively assess uh, program and growth. We do leadership coaching and capacity building. Our second bucket of work, we do direct services to communities. So currently, we have a parent leadership cohort at schools where we support parents around engagement and advocacy, support young people from the age of 18 to 24 and match them in social impact field, specific to this study around mental health. And our last bucket of work is around youth development. And essentially, we support young people in after school program, residency programs on just becoming change makers in their neighborhood through a design thinking process, and that involves a lot of social emotional learning and identity work. So the premise is that whatever community that we serve, we are here to shift power dynamics.
Thank you so much for those introductions. Before we begin, I just wanted to run through today's agenda. First, we'll begin with a study overview. We will be presented by Faith on the key findings, and then we'll have a panelist discussion. At the very end, we will also be looking at ways that we can go into the future with interventions, and we would love to have you all participate in our panelists Q&A. So the study overview is really looking at the perspective of the Black family and how they have experienced mental health. This was a study that we surveyed 1,000 parents, Black parents in 2024, as well as 500 young adults between the ages of 18 to 24 to better understand their experiences, their thoughts, their beliefs around mental health in the Black community. The participants were from Black African American to Afro Latino, Afro Caribbean, as well as African immigrants. And this was done in conjunction with the Child Mind Institute and the Steve Fund. So I'd like to begin by asking the panelists, why is this study important? I'd like to begin with you, Dr. Boyd.
This study is important for a number of reasons. One of the things is a recent understanding and portrayal, a snapshot, if I can say, of how Black families and young adults are thinking about perceiving mental health treatment and services, and particularly is post-COVID. And so we understand that the mental health needs had increased across the population, particularly in the Black community, is coming in light of all the health disparities discussion that has happened at a national level of understanding that mental health care, there's also health disparities. And so we're talking about it in that light. And I think having a nationally representative study is very important. So we understand that this doesn't just represent one city or state, it represents the whole United States.
Today?
Yes, I would like to echo some of the points that Dr. Boyd make, particularly, it just sounds a necessary light on the unique experiences that and barriers that Black families have when it comes to the mental health system. And it's often when you think about Black people as a community is usually overlooked in the mental health research. So I think it actually like addresses like a real critical research gap. There are things that came up in this study that we may have been aware of, but we never really were able to like attach quantitative data. And I think having this kind of data-driven insight, on racism and stigmas that also impact access to some of this healthcare, kind of moves it from just being anecdotals to more actionable steps. Um, I also think it just if you look at the diversity of the study, there was Afro Caribbeans, African Americans. Um, so this honoring these Black voices in general is something that is usually overlooked. I think is a great opportunity to get deeper insight. And I think for me, what's most paramount is just exposing the systemic barriers. We are familiar with just certain stigma when it comes to mental health in the Black community, but there's actually like real system and constructs when it comes to just inadequate healthcare, lack of Black providers, just high costs. So these are systems that actually not only adds to the challenge that we've faced, but they're also systematized. So like now we have to look at it from more of like a policy level as well as not just culturally.
Thank you. As we speak and as you've referenced the study, I'd like to invite Faith to share her key findings.
Hi, everyone. I'm a senior staff writer on the editorial team in our CMI department. I am also the study coordinator of the Mental Health Support for Black Families study. According to a recent U.S. Surgeon General's advisory on protecting youth mental health, Black youth younger than 13 are almost twice as likely to die by suicide. Additionally, Black youth have been shown to exhibit higher rates of anxiety, depression, and other stress-related mental health challenges. That's why we've decided to take part in a study that focuses specifically on the mental health needs of Black children and young adults. So now I will discuss the key findings that were found in the study. First, more than three-quarters of respondents expressed an overall positive view of mental health care and mental health professionals, which indicates a shift in views within the Black community around mental health. But at the same time, nearly half of the respondents still felt that there is stigma around mental health disorders, but this did not keep parents from seeking mental health treatment for their children. And while children and young adults experience three mental health challenges on average, they reported only receiving treatment for around two, which highlights the need for a more widespread access to mental health care. Additionally, anxiety and depression were the most commonly reported mental health challenges, specifically among young adult participants.
Thank you, Faith. I would like to begin the questions with the panelists, and I'll start with you, Dr. Boyd. Despite the history of mental health stigma within the Black community, the results of the study indicate positive shift in views towards mental health. What factors might have gone into this change?
So, one of the things I thought this was a really exciting finding because often people talk about Black families, children do not want to go to treatment. And I think this showed that Black parents were willing to take their children, Black young adults were willing to go to treatment. And so this is possibly a generational shift. We understand that there's multiple generations that are currently and that things are changing. I believe, as I mentioned before, we're post COVID. Mental health dialogue surfaced significantly during the COVID time. The mental health needs increased. And so it seems like Black families are willing to have this discussion, to engage in treatment, and have more potentially to use these services. And so I was very encouraged. I do think the younger generation is encouraging their parents and their grandparents and aunties and uncles to have these conversations now, and that we need to have this more in the Black community.
Well, one of the interesting points that was made or that was identified in the study is that parents were less deterred by stigma um, than young adults were, or young adults might be more sensitive to stigma. Why do you think that is, Dr. Boyd?
One of the things that we recognize is that parents are often willing to do what's best for their child. That is their priority as a parent. And so they're willing to maybe go against stigma, maybe not if family members disagree, to get services because they want the best for their child. And so oftentimes they may neglect their own well-being and mental well-being to make sure that their child have their own their treatment. And so we probably see that's what's taking part in this. One of the things that did come up is that actually parents often go to their pediatrician, primary care doctors to get information. And so pediatricians are screening children at all ages. And they also are looking for developmental behavioral issues that come up. So oftentimes parents may be often getting that information from pediatricians who may give them insight on what to do. And so having that trusted provider also can encourage parents to utilize mental health treatment.
Ade, as someone who works in the community and specifically in diverse and Black communities, how would you say that mental health providers and organizations can help to reduce the stigma in Black communities?
Yeah, for myself as a even like a former educator, one of my like principles is just kind of like meeting people where they're at. I think just kind of like normalizing the conversations in schools and after school programs and community centers and even online platforms. I think that a lot of times we tend to like might have a mental health week when mental health is your fitness, it's your nutrition, and how you operate on a day-to-day basis. So like what does that look like, us normalizing those conversations? And I would even like reimagine like how do we bring young people even cultural linguistic around some of this terminology, right? A lot of time I think some of the language could be a little bit alienating, especially if something that you don't identify with. So I think there's opportunity for us to have a real push by way of like co-designing what young people want to see, right? So there's always this idea of trying to build something for someone and not with them. So in regards to how what would a campaign look like, or just what do young people want to hear, I think there's an opportunity to do some level of co-designing while we bring young people in, and how would they like that to be messaged to them, right? And I think a very easy oversight is just train and empower like trusted messengers. And I think we'll get to that in a second when we look at the lack of trust the young adults have in the mental health care system, where they tend to like prefer to speak to whether it be a peer or a coach or a mentor. So what does it look like for us to train those trusted messengers that they can support our young people?
Ade, speaking on that, could you briefly describe, because as we done our introductions, we kind of like skipped over the point that Ella Baker Institute, which you're one of the founders of, has worked with the Child Mind Institute and school and community programs to launch 2 years of a pilot camp where we added mental health skills into 1 week of camp during the spring. So that's a bit of like, that speaks to your intervention. So can you kind of like speak briefly about that?
Yes, particularly to the camp, what was great, not only did we add like the social moments for the learning in partnership with the Child Mind Institute to the for the young people, it was also supported by we also added other stakeholders as including their parents, right? So one of the things that we discovered when it comes to just like some of this social emotional work and even like identity development work, folks just need the language to communicate what they're experiencing. So it became empowering when it comes to learning about self-awareness, when it comes to learning about big feelings and little feelings. Um, there's a level of connection not only did children and adults have by going through that experience together, but it also supported on how folks are able to communicate with each other to kind of build a more human-centered, harmonious experience, not just inside the classroom, but at home, and that was kind of reflected in the survey as well.
Thank you. Faith, can you please share some of your findings?
So significant differences, as Ade mentioned, were found between female and male young adults specifically. Female young adults were more likely to report experiencing substantially higher rates of depression, eating disorders, suicidal thoughts, and trauma, while male young adults were more likely to report experiencing ADHD and anger management issues. Furthermore, young Black male participants were much more likely to reach out to family members, friends, and religious leaders instead of mental health providers when experiencing a mental health challenge. This indicates, as we talked about earlier, that there is some hesitation within young Black male communities around mental health care.
Okay, so off of those findings that Faith just shared a day, the results indicate that reluctance for Black men to be able to actually seek mental health support within the mental health sector, that they're going to their own communities and friends and churches. Can you speak a bit about that?
Yeah, I think when you think about the systems in general, there's a deep rooted like cultural context to this, particularly for Black men. So if you talk about there's really no psychological safety with anything that ends with system, right? So if you think about like school system, the overrepresentation when it comes to like suspension or even students with special education. If we look at the medical system, and when you think about a gender and a demographic that most likely to have chronic disease, um, and the list goes on. Anything that ends with system there's no real psychological safety. So immediately the issue becomes layered, and that is like coupled with just intersection of like stigmas and masculine norms that we operate in. So there's just a deep mistrust, um, and because of that deep mistrust, it's a very 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 I want to say safe, confidential space that Black men have to operate from, and a lot of time we find that in our proxy. So I think that in order for I could speak to my own experience when I decided to go to therapy post pandemic, which is something that I thought about doing for a very long time, but I had to build a confidence up to actually enter that space for whatever reason. And I remember just kind of entering the space. I only did like 2 sessions because it did not feel safe in there for me. And I didn't go back since, right? And so my point is that like, you go into a space that's super layered and you come in with all these different challenges. And if the conditions are not set and the root cause are not addressed, you tend to not operate from a place of rationale when you try to actually seek help, right? So I think something to really think about when we consider, particularly for Black men, is like what does it look like for just like confidential, um, you know, safe space where we get to exercise vulnerability in a way that we may not do on a day-to-day basis.
So outside of safe spaces, what do you think mental health professionals and educators like yourself can do to help black men and black young adults feel comfortable in seeking that help that they need?
Yeah, I'm a big proponent of like community-based interventions, right? So if I say my barber is my therapist, let's train the barbers, right? So I think just building like deep partnerships with like community, like whether it be churches, community centers, fraternities, uh, um, I think is an opportunity to kind of like again, trust the messengers through rigorous and comprehensive training, um, and just kind of normalize the conversation in those spaces, um, not just where folks are just occupied. So thinking about just schools and centers that people are engaged on a day-to-day basis. What does that look like for us to continue to normalize those conversations?
Here, Faith, can you share some of the additional findings?
So both groups cited racism and the difficulty of finding Black mental health professionals as a key barrier, with half of participants agreeing that mental health professionals who are either white or non-Black POC misunderstand or underestimate the effects of racism on their mental health. They also expressed concern that mental health providers are too quick to prescribe medication for mental health challenges.
Hey, so Dr. Boyd, the findings that Faith just shared shows this history of mistrust between mental health providers and the Black community. Can you talk more about this?
Yes, I think this study, directly asks about experiences, perceptions about providers, and particularly, which I know wasn't sure about, experiencing racism in the mental health, which is in the report. Uh, Black parents and the young adults express that they have experienced racism in the mental health care system, and so I want to make that clear that these experiences are happening. In particular, that they view that particularly that providers may underestimate or not understand the impact of racism on them. And they were pretty similar across perceptions of white providers and also other providers of color who were not Black. And so I think that they were viewed similarly. And I think that really brings up the point about having these negative experiences that occur. And Ade had mentioned about things that happen in the school that they are occurring and sort of the impact of that. People not fully understanding what it means to be in Black skin and understanding the racism that occurs. And so I think that is important for providers to understand that they have to learn those things and how it's perceived. The report will also show that there was a perception, a portion of families, young adults that mentioned that their symptoms were ignored, that they were talked down to in receipt of mental health treatment. And so these things need to be addressed.
How do you think that we can address those issues as mental health providers?
One of the things, what we're doing right now is a perfect example. Training is important. We need to provide this information, have this dialogue. Providers have to really begin to recognize their implicit biases, but also their explicit biases, their stereotypes and their perceptions that may not be accurate. And also that the Black community is not the same. There's huge diversity, variability in the Black community, and really spending time getting your client, patient, however, perspective and worldview and where they come from, and spending that time to understand and try to understand, to read about it, to do seminars and trainings, but taking that time to take people individually to learn their perspective clinically. I also spend time learning about my patients and what they may do, their neighborhoods, their school environments. I'm really understanding the context where they come from and utilizing that information to recognize that we can't just say they're Black, this is what they do. And also recognize these systemic issues that, when they're in this space, that they're more likely to go to child welfare, to the legal system, juvenile justice. I mean, we have to think about sort of our actions and how to step back and really find things that are family centered and kid centered, that don't sort of be seen as punitive and harmful to children and families.
Speaking of feeling like they're being harmed, both parents and young adults were both aligned in their concerns about being too quickly prescribed medication. What are your thoughts on that?
That made sense because I see it clinically. And I think both of them expressed that. I mean, part of it, and I'm not a psychiatrist or a medical doctor to deliver, but many of the patients that I see, it may come up, particularly I see youth and young adults with depression. And so oftentimes depression, the treatment, especially for more moderate to severe depression, is both therapy and medication recommended. And that many times you get feedback about not wanting to go on medication and having that discussion. It goes to sort of the history and that Black families, individuals have experienced in this country about how the medical system and has been harmful to them. Particularly, parents are concerned about the impact on their child's development. which would make sense. Like, what would this mean for my child when they grow up? This medicine will affect their growth, things like that. And so we do have to consider that. Oftentimes, my approach is, less maybe make a plan, consider talking to the psychiatrist or nurse practitioner and see how therapy works. There are some cases which, if a child is experiencing really severe symptoms, but part of it is a dialogue and having that conversation and getting families on board for a treatment plan.
Thank you. Faith, can you present on the findings?
Yes. So the study was also able to identify key systemic barriers that were faced by both parents and young adults, which included a high cost of treatment, a lack of available mental health professionals, long waiting lists for appointments, limited insurance coverage, and a lack of mental health professionals in general in the area. We also found that the higher a respondent's income, the more likely they were to say that they had access to care and that they trusted their mental health provider. But they were also more likely to say that the effects of racism were underestimated in their care. We also asked the participants to weigh in on what they would like to see in terms of improving mental health care for Black communities. Some of the suggestions included integrating mental health screenings into routine checkups, working with churches to raise awareness around mental health and mental health services, increasing the amount of Black mental health professionals available in the areas, and investing heavily in community mental health centers and underserved areas, as well as developing AI chatbots for initial screenings or between session support. So the study and the report was able to highlight the complexities of the Black experience within the mental health care system. It also opened doors to a larger conversation around how to improve access and quality of mental health care for Black children and young adults. And ultimately, we concluded that more research needs to be done that focuses specifically on the mental health needs of Black children and young adults. Um, so as you see here, I do have a QR code up for if you would like to go to our webpage, which has the report, as well as the literature review and executive summary, and other related materials, including a supplement that the Steve Fund did, where experts such as Dr. Boyd were able to give suggestions on how to overcome these barriers. We also were able to write articles specifically about the needs of Black children and mental health, particularly around the need for cultural competence in therapy for Black children.
Before we go into our questions, I just wanted to add that the team that I lead here at the Child Mind Institute, the School and Community Programs team, we have a team of clinicians that are in the Bay Area, New York City area that are in schools where we prioritize a 75% rate or higher of free and reduced price lunch. And we also are training educators, educational staff, and clinicians around the country on best practices and how to implement mental health skills in the classroom, as well as treatment groups within schools. And for us on our team, it was really important that we made sure that our materials, that the trainings that we were doing were actually culturally responsive. Additionally, this study to me was so impactful in reading it. It really felt like, a foundation on how we should be approaching our engagement around Black families and Black communities. I felt like it was really critical information that I wanted to, that I was excited to share with my team so that we can do this work even better. As you learned, working with Dr. Boyd and also working with Ade, and really looking at interventions that we know are going to be impactful in the community, taking it out of the clinic space, putting it in schools, putting it in community-based organizations, and putting it in church, after school programs, and being able to really implement this training and this education in a way that is accessible, and that's not just accessible in the information itself, but accessible in communities and community settings. So that is how we're approaching it here. So I'd like to kind of end the last question for both Dr. Boyd and Ade, to ask you, what types of interventions would you like to see implemented in the communities or within the mental health care systems?
Yeah, for me, I just want to echo something that Dr. Boyd said. Like, I think there just need to be ongoing funding for just kind of like cultural humility training. I think sometimes these things could be like a little bit one off, but I think just creating some structures around that can really support with some of the stigmas and the systematic barriers that the study was able to identify. I do, as I mentioned before, I am uh, wholeheartedly big on just community-based providers and making more greater investment around that. Um, and I think we need to like kind of reimagine like insurance coverage and think about some like non-traditional healing modalities. I think there's a prescribed understanding of what healing is supposed to look like. And particularly for the community that I serve, I think that could look differently. And that's something that needs to be surfaced. And just like more peer programming for peers to support each other. uh I mentioned like just kind of the idea like co-designing and support. One of our core practices at ABI is moving from dependence to independence. So what does that look like for the community to support each other? So embedding these mental health conversations and like in core subjects, and creating like wellness hubs for students, and just creating like shared language on what it this emotional health, and just how do we identify the thing that we're talking about. Because I think sometimes that could be a distinction for folks that creates the stigma. So just the shared language around that. And for us, oh, I'm sorry, I'm Dr. Boy. I think I'm getting ahead of myself.
Okay.
Mhm.
It's fine if you wanted to continue, but I can go.
I was cooking. I just so let me take a step back.
Okay. I just want to add, I think we kind of are in agreement. We've been talking about really engaging the community and how to take mental health, destigmatize it to make it more accessible in a community where youth and young people are. And what does that mean? And we're going to have to figure out the insurance issues. But I think, and also, I'm very uh, proactive about prevention, starting early before youth are experiencing significant symptoms. How do we sort of do things in preschool or when someone is just born? And how do we identify learning disability, developmental challenges that could happen early on that we can prevent? Sort of more challenging behaviors later. And so I think the school is very important. Also, the pediatrician, also the community. How do we bring everyone together to be on a trajectory to have multiple services? Because people need variety. It's not a one size fit all. And to have different types of programs that could be available to sort of build resiliency, coping skills among young people and their families, because people, particularly Black young people, males and females, will be experiencing challenges. And we know there will be racism, there will be issues with maybe income, community violence, that disproportionately happens among Black families and in Black communities. And what does that mean to how to foster resiliency in those areas for these families so that kids can be able to survive and do well? And so that's how I proponent. And I do want to bring up the issue of the diversifying the workforce. We have not said it. They said we do not have enough Black providers. And that is the reality among all the mental health fields. And for some groups, particularly like psychiatrists, they are almost hard to find, particularly people who work with children. There's a dearth in those populations. So when you think about that, so we need to really be strategic in diversifying the field to have sort of community workers, but also psychologists, social workers, counselors, psychiatrists that are Black, and how to increase that. So,
I think we're in alignment in those solutions. Here also at the Child Mind Institute, we also have a Youth Mental Health Academy, really to address those same concerns of having that representation. And it really is an amazing program that we're operating on the West Coast in California to engage youth in high school and really introduce them to the field so that we can grow up, so we can grow mental health professions so that they are more representative, so they're able to be in the community, and so that we'll have less of this gap and between that understanding. So thank you both for your comments. With almost 900 participants in the audience, I would like to open this up for questions. So I'm going to segue to the first one. How would you all suggest normalizing conversations around mental health as a school counselor? How would you to get parent buy-in? Either one of you can start.
Yeah. Yeah, I think I think the first step is just taking the initiative, right? I think there's also the assumption that people don't want to have the conversation. And it's it's not that they parents don't want to have the conversation. There's just not enough opportunity to do so. I think that right now we are currently um because of our partnership with the Chama Institute during our spring break camp around the social emotional learning, we are now leading an initiative where we're like co-piloting um, curriculum where we're bringing like school leaders, social workers, and youth to create this like to redesign their disciplinary system through like a healing lens, right? So it's just and the idea around it is just getting the different stakeholders to kind of get their understanding on what kind of experience they want to create for young people, um, and creating an actual framework for them to operate in. And I think just collaboration and just taking initiative, you'll be surprised how much, um, folks, particularly parents, want the support, and they just don't know, have access or have a way of understand how to get access to this information.
Dr. Boyd?
Yes, I'll just add, I think part of what Ade was saying about building that dialogue. Also, sometimes psychoeducation is needed about sort of what you should see at a child at a certain age and maybe what types of behavior the child is experiencing. I'm also thinking about, and I think that came up with the report about some of the root causes. A child may be behaving a certain way in school. They may be different in extra, school activity. They may be different with their family members. Sometimes they're in two different households if their parents don't live together. And so really teasing apart about what you're seeing maybe in the school environment, is that being seen in other places? And then trying to figure out maybe what may be going on. Often, which I tell families, to do an evaluation, to go check a child out, even if there's no problem, it's better to kind of have that conversation so then we would know everything's fine and get some suggestions. You should not wait till your child is really severely impaired, and then it's harder to treat. And so I do think as early as possible to start checking behaviors out that may be concerning. I don't think that's a waste of resources. I think it's important to be able to do that and sort of have these conversations.
I think that is like important, especially for a team that I lead that have those conversations all the time, because the advocate is usually the educator. It really is understanding how you're delivering that information to the parent. Because what we hear is we want to provide support, but what the parent hears is, me, there's a problem with my child. So I think for us, it's really understanding that kind of that perspective and having empathy and providing warmness in the conversation. So I'll go on to the next question. What should schools be doing differently to support the mental health of Black students?
I think
Okay,
just
I'd love to
listening,
hear
listen, listening to Black students. I think there's uh you know there one of the things that um uh, becomes like easy oversight is not understanding, not having the assumption that people don't know what's best for them. So for schools, I think it just comes down to like the intentionality around it. Um, when it comes to Black students and some of the challenges that they face on a day-to-day basis, um, there are pockets and silos that they actually get to communicate these things or don't have like the toolkit to actually um, indulge in some of the traumatic experiences, and that those adverse experiences can lead to a lot of misunderstanding how they engage in their day to day. I think that if there are structured processes that are specific to helping Black students by way of like normalize the conversation around mental health and social emotional learning and not treating it as like a one off, um, you see that students are more easier for, based on our experience as well, students are more able to buy in on what type of culture you want to create when it comes to mental health. So I think for schools is really being intentional on the designing of these programs, which because of so many different priorities, uh, and when you're held to a specific standard when it comes to assessment, that sometimes, you know, you have young Black folks, particularly in, I can speak to New York City, um, take these assessments and it kind of reinforces certain insecurities. Even that in itself, Black children need support around it. And how do you mechanize that, right? Um, so there is a listening component and being intentional around supporting that by putting different programs and systems in place.
Right. Yeah, I just want to add, I think it's important. I'm going to take a stand that maybe not fully mental health, but I think it's all mental health because health is mental health. I mean, for schools, many ways, it is actually school connectedness. Having a trusted individual in school is a protective factor for Black youth. And so having that space and that climate important, having extracurricular activities, teaching coping skills, resiliency skills at the classroom level will help Black youth, particularly free lunch, you know, making sure they can have food to eat. And also these kind of their basic needs being met will help with the mental health. And I think we need to think about it holistically, having activities. So often kids don't have any activities to do after school, and they're falling into things that put them in dangerous situations. So having those safe places is important, and then they will be able to talk about their mental health or what's going on when they feel safe and protected and have an environment that supports them.
Thank you. Ade, this question is for you. When you say train barbers or fraternities, what kind of training are you referring to?
I think when it comes to like training, I think it's important to like even something simple like just identifying like signs and risk factors of your client that might be experiencing mental health, and just you know between like just mindfulness or just resources or stress management, things of that nature that can just support in the discourse that you're engaging someone is telling you such heavy information. So what does that look like to manage those experiences? I think there's a diversity in what that training could look like. It doesn't have to be when somebody just becomes a risk factor, but that could be included in training. Mental health is not just when we are at our extreme. Is how do we sustain, and that shows up in many different ways.
Can I add something to that? I think also things like, mental health first aid for, people who just regularly interact. I think coaches, people at the rec
Mhm.
centers, people in the churches, the school attendants, the crossing guards, like they can sort of have this mental health training so that they know how to respond. We understand about trauma, being trauma informed, so that these are light touch spots, but youth are everywhere, and so that's what we need. Something as simple as that can be done sort of large scale.
We've been trying to push the message across that just like we have physical fitness and it's like you have to be healthy, there's also mental health fitness. And it's in the same way that you have to have these routines and these exercises on a daily basis to check in with yourself. It's the same, it's to be healthy. Physically, you have to do the same thing every day to be mentally healthy. So, Dr. Boyd, what avenues can Black pediatricians use to reach more Black families seeking mental health care?
So I know this, we talk about sort of the access issue, and I know so this is the issue. So many times pediatricians are doing mini screenings. And so, as we mentioned, parents bring their kids to their doctor's appointments. And so, this is an opportunity. Many times, the pediatricians, many times they know maybe who in the community that maybe be able to help, who are taking people for treatment, but they can be a conduit. And there are some programs set aside that actually give more expertise in training the pediatricians to handle mental health. I know we're doing that at the Children's Hospital of Philadelphia. So, and I think someone did write a comment about many times pediatricians are actually prescribing medications also, and so or primary care doctors, and so that comes up. And there's expertise from pediatricians. There's ways to get more expertise for pediatricians so they be able to handle um, these issues. A lot of training because I imagine they're being overwhelmed. They're dealing with the physical health, but also with the mental health and the school issues. But hoping to build their capacity and maybe even find other support staff. Many times social workers are embedded, psychologists are embedded in some of these pediatric offices. You can also use nursing and other support staff to kind of help with sort of some of the mental health needs, and particularly screening for social determinants of health. As we talked about, are there issues with food, transportation? And so being able to address all the needs of youth and families are important.
No, I think that's important having like that first screener. Everyone has to get their medical records to be in school in public schools. So integrating it into the pediatric care, I think is is a key touch point. Um, so I have another question. How can I, as the only member in my family who sees the value in mental health care, drive the conversation regarding receiving care? I want the next generation of my family to be able to have conversations about mental health outside of just me, giving that various disorders run in my family and are often diagnosed. So, how can you be the person and how can you be the catalyst to start that conversation?
Um, I mean, well, one, just being the change that you want to be. When you the question, I could like super connect to your challenge and something that uh myself still trying to figure out on a day-to-day basis. So my best practice is being a model for what the expectations are when it comes to not only now my immediate family and how I go about sharing resources is just being an exemplar of what I would like to see for just my family and my community as well. So there's this modeling piece that's like really important, and there's also just kind of meeting folks where they're at. And what I mean by that is, you can actually overshare and actually have an like adverse experience on people seeking mental health, right? So it's a very like tactical process that I know for myself that I experience where I've seen the impact of mental health in my own immediate family and ask myself that question on a regular basis, like, well, how do I become that catalyst? And I think it just takes time and being patient and giving yourself grace and giving your family grace, but being the model that you would like to be.
Dr. Boyd?
Day, I think that was excellent what you said. I just want to add, just having conversations, they may not be every day, but opening the dialogue. I know in many of our families, there's these things of they have something nobody knows about, no one talks about, but trying to put it to light, understanding that, is important. I also talking like to know about what runs in our family because it affects our health, the next generation health. Does someone have anxiety? What is it? The uncle that doesn't leave the room, what is those kind of things? And so really just trying to ask questions. And I know they not all of, but trying to start it little piecemeals, it chips away at it to have these conversations. And I do think families are changing, uh, and I do know it doesn't happen in all families, but just being open. And I love your thing about grace for both a day.
Dr. Boyd, hearing you speak also just made me think about just the also just the approach of just leading from a place of curiosity and just not judgmental. So, even in that experience is like just asking more questions and instead of making statements as our approach. And it's something not just for folks with mental health, but just in general to build a better world. But I think that's when in those specific uh opportunities when you're supposed to lead with curiosity at all point.
No, I think that's key. I think approaching those conversations in a very empathetic, understanding, graceful, and curious way helps to make the conversation easier to have. Um, so how can Black churches support the mental health needs of Black students and young adults in their congregations?
I guess start. I think that's important, and I know the Steve Fund. That's something that they're planning to follow up more with. Came out about working with churches, and what does that mean? And I think we're saying churches, but I think we also should talk about all religious type of organization. It could be the mosque, it could be the temple. So how do we sort of get a foot in sometimes? And I think New York, they have some programs in which they're doing things within churches, but really finding the church leadership that's open to have these issues and really partnering. It could be workshops, it could be sort of a more long term uh, association. I know a friend of mine, her church actually they have a resource of people in the community that they refer for mental health treatment. So if you're getting that from your the church, that that builds that trust already, and so I think models like that can be utilized.
Yeah, I say again, just supporting these trusted messengers with like just basic mental health, like literacy and even possibly like referral tools. I think because which is reflecting the data, the stigma is a real thing, right? So like once you have someone that you trust, that stigmas tend to lose grip. So what does that look like for us to train, support, and give language to these trusted messengers and really lean into them?
One of the things I would like to add is just showing up with information. I used to do lectures at the soup kitchens in churches, and you would be surprised to know people are really engaged in those conversations. And just like, once you get the access in, just show up with that quality information, and people can decide if they want to actually access it or not, or ask more questions. But I think just sometimes just showing up and build those networks are really going to kind of like just start moving the dial. So that we have another question. How can we become that trusted individual or children for our children and grandchildren, particularly those who live and attend schools in predominantly white spaces? This is interesting. Dave, would you like to start? I think it'd be interesting to hear the perspective of an educator.
I just want to make sure I understand the question. Do you mind
Sure.
answering the question?
How can we become trusted individual for our children and grandchildren, particularly those who live and attend schools in predominantly white spaces?
Mm. Um, and that's a great question because I feel like those um that traumatic experiences that Black children go through it in some of these predominantly white spaces is always easy overlooked because they have an opportunity for access. But there's a I think there's a lot of identity work that comes with that, right? Um, that when you enter those spaces, uh, there's really have to be like a robust understanding of self. And so, what does that look like? Building up self for the young people in and outside of school, as well as equipping them with a toolkit to deal with the challenges when their identity is being challenged.
Dr. Boyd, would you like to add?
Yes, I think part of it is just being there, getting to know the young people, um, and that they'll build trust. I think young people pretty much they can see when someone is in their corner. And so kind of just showing up at different activities. I remember when I was on internship, it was a long time ago, I was in DC, but I was placed in a school a middle school. And so I was sitting in a classroom and they told me to start groups. And all of a sudden, these Black young boys, I think they were like 7th and 8th graders, they kept coming to me and tell me whenever they had a problem in school. But just me being there. And next thing I know, I started a group with them. And these were probably not, I think they were like basketball, football players on teams. So they were like probably the popular kids in middle school. And it was just so interesting. But, they saw me. I showed up twice a week at the school and they trusted and know I was there. And I guess they brought more people each time because it was a positive experience. So I do think you have to be in the community, you have to be around the kids, take them to places. I know, I was just joking how I used to go to so many dinosaur exhibits, taking my nephew when he was younger. But they have to know that you can trust and do things for them and following through on what you say. I always try to make sure if I tell a kid I'm doing something, I will definitely do it. I do not want them to feel like you're not someone they can trust or follow through on your promises. So
Um, I I think that it's important to always kind of like create as many safe spaces as possible. Um, in the family, in the community, and then if you can, you try to build them in schools. So our next question is, what are actions community members can take to help local communities? My quick thoughts are attending city/town hall meetings and school board meetings, but I wanted to know if there are different ways to get more active towards this issue.
can you read that again? I'm just trying to process it. I don't know if you were going to say that.
What are actions community members can take to help local communities outside of like doing the town hall and community board, being in those spaces? Like, what can you do within your own community and proximity to help?
In, well, speaking for like the New York City region, like I just recently just got an email. I want to say within the last 24 hours where there's the Department of Health and Mental Hygiene. They host these like mental wellness and resilient workshop, and they actually been offering it for free uh for the last couple of years. But I received an email that they may no longer offer it for free for whatever reason. And you know, I think getting just the right information. So I've partnered with this program before and brought it to like as a part-time adjunct professor to students as an opportunity to become a mental health aid certified and things of that nature. But this was all free. So my point in bringing that up is that there are resources out there that you can probably have access to that you may not be aware of that might take a little time just to look into that may not be the same now in their current climate, but they're out there, you know. So what does that look like to really tap into your Department of Health and Mental Hygiene and community-based organizations like ourselves? We offer programming um, around social emotional learning, not just to students, but to parents as well, and tapping into those folks that are actually like on the ground. Uh, and there are a lot of grassroots organizations that's doing the work. So the effort in just trying to like get those partnerships is probably just going to be half the battle.
Dr. Boyd?
Yes, I think also there's organizations that you maybe can partner and volunteer with. There's more national organizations that have local affiliates like NAMI or American Foundation Suicide Prevention. But there's probably maybe ones locally that may be doing things in the community. And sometimes that makes it easier. You can partner with someone already doing the work so you can help bring that lens into it, or you maybe can create, if you feel like they may be not addressing issues of Black children and families, can bring that to them because they need, many times, most organizations, especially mental health, they need more people to help, more hands on board. So that may be an opportunity also.
Yes, and I also think like being able to have resources readily available. The Child Mind Institute website does have a series of videos for parents. There's 20 different topics that I think that like if you just need something quick and immediate, those are great videos to start those conversations. And you can really direct communities as well as parents if you're in parent groups to be able to like look at these resources to have like a conversation starter. So I have another
I
question.
just know how great those resources are, and then we use it with our school community partners, but with our parents. So I highly recommend those videos on the Child Mind Institute website, particularly to support parents.
Thank you.
I'll
Uh,
just add that the Steve Fund also has resources that are available that support schools. They do a lot of work with colleges and also things for family. They have family support groups and things like that. So I think between organizations, there's a lot of supports out there and resources that people can utilize. And more will be coming from this report.
and they're quality. They're great quality. I just wanted to like elevate that point. So we do have a specific question on how to engage young Black men, because that was one of the things that came in the studies that there's an impasse there. So how can we kind of like have an approach specified for young Black men? A day.
Yeah, I think I mentioned the space has to be tailored. There's a lot of it needs to be a incredibly safe space, and there's spaces that young Black men might be occupying right now, whether it be with in the after school program, whether it be with their sports team, uh, what with community providers. That While I think it's important to have these community based interventions, because like trust is paramount, and being able to create mechanism to be unlayered, um, that takes time, and you know and a lot of psychological safety. So it doesn't it's not a one size fit all. I think normalizing the conversation as well, and it not being something that is just more strategically input as a compliance, can support with just supporting Black men around that experience. But I I think we need to exercise whatever proxy that we are operating in, and lean into it.
I think that's Dr. Boyd, would you like to add to that?
I just want to just bring up again a whole issue about the diversifying of the field. So if someone wanted to see a Black male therapist, this is what I guess they were saying, like a unicorn almost. I mean, a Black provider anyway is almost like a unicorn. Black male providers, I mean, so this is a part of really growing the field because it's really hard to find them. And many times people may say they may have to use telehealth or something to even find. They won't be. And if someone live in a rural place or certain places, some states don't have a lot of diversity in Black providers. And so this is an issue that we just need to address in the field.
Mhm. And I think that's key. And I wish we had a magic wand to create providers overnight, but until we get there, I do think that this report is a great way to start to see where there are gaps from the perspective of the parents and from the perspective of the youth and young adults. And having a better understanding of that is how we can really create not customized but responsive care as providers. Faith, would you like to conclude?
Yes. So Dwayne just put it in the chat, but just want to let everyone know that the recording to this event in both English and Spanish captions will be available within the next few days. That email that I'm sending will also include the presentation slides. It'll also include a link to the webpage for the study, which has the report as well as other related resources that I mentioned earlier, including articles, the webinar that we did on the literature review portion of this last year, as well as all of the supplement materials that the Steve Fund graciously put together.
Um, Dr. Boyd and Adair, would you like to share any of their current projects and ways that the audience can stay connected to you?
Yes, yes. Two things. One thing I thought about while Dr. Boyd was talking, in addition to more Black provider, I think it's also important how we look at curricula in the practice, uh, because you can have more providers, but if it's also still white centric, it doesn't. It still does harm. So just something for us to think about, like how do we, um, as a as practitioners in the field, how we making sure that it's not only just culture responsive but community responsive. Um, I'd love to put my website in the chat. The Ella Baker Institute, like I mentioned, we have three different verticals of work that we do. Org work, we work with schools and direct facing work with the community. So we always looking for folks who want to get involved and engage. Like I mentioned before, right now we're co-designing a pilot curricula that we're bringing different school leaders, youth, um, parents on redesigning disciplinary systems that are centered around a healing lens. Um, and you know, I love to connect. If anyone would like to reach out, again, my name's Aday, and this was awesome. So thank you for y'all listening to my testimony.
So I'll include everyone's contact information as well in that email that I send. And I'll send the links to the Steve Fund and Ella Baker Institute.
Mr. Boyd?
Yes, I just want to, I guess, add about the Steve Fund is will be developing workshops and resources for families, thinking about how to partner with churches and other religious organizations around this work. Also, they are planning develop a curriculum for protective factors for families, and so and also how do we move this research and think about some new ideas. We didn't answer everything, and so many times research produces more questions, and so thinking about what are some of the next steps in dissemination, but also how to get more information that could be utilized to inform the field.
Well, I just want to thank everyone for the panelists, of course, for spending time with us today, really looking at the results of the study and being able to really add your expertise in how we can create interventions going forward and, and how we are relating to Black families and children and being better at it from the information that we found in the studies. I'd like to thank everyone who joined us today virtually to be able to listen to our responses from our esteemed panelists. Thank you so much, Faith, for really coming up with this idea and being curious about how Black families are perceived in the mental health space. So I really appreciate being staying curious and then also putting action to this, so we are able to like survey to really pinpoint these feelings. Sometimes we have an idea and we go from our lived experience of like how we're being treated in the mental health space. So actually having the data, which is really, I would say, is one of the key points of the Child Mind Institute, is really looking at the data and analyzing in a way that from every perspective, it's clear that these are issues that we need to kind of address. And moving forward collectively for all of us that are on the call today of how we can take this information and this data and really create interventions and safe spaces and curricula and conversations within our families and our communities to be able to drive mental health in a positive direction. So thank you all and have a great afternoon.
Thank you.
Thank you.
Thank you.